Pooping is just something that everybody takes for granted until you have a problem doing it. And so as a pediatric colorectal surgeon, that's my passion, to be able to get kids to not worry about that so they can be kids. I'm Dr. Iris Lim. I'm a pediatric colorectal surgeon here at Children's Mercy. So I'm both a pediatric general surgeon and specialty trained in pediatric colorectal surgery. I chose to go into pediatric surgery because of my youngest brother. I was 8 when he was born, and at the time, the doctors thought that he had what's called an omphalocele, where his abdominal wall didn't close properly. He is totally fine now, but as an 8-year-old, I was exposed to a pediatric surgeon who essentially told me how they were gonna fix it, and that to me was amazing. A lot of the problems that I focus on are based on problems with the colon or the anus in children, whether it's congenital or acquired. So congenital meaning they did not develop any nerve cells in a part of their colon, so that's called Hirschsprung's disease, or their anus was actually developed in the wrong place. That's called an anorectal malformation. In terms of acquired, I also focus on children and adolescents who develop inflammatory bowel disease, such as Crohn's or ulcerative colitis. My approach to patient care is kids first. So what that means to me is if a child is of conversational age, I direct my questions to them rather than to their parents, because particularly in my group of patients, these are patients that I'm gonna see for a long time. This is a lifelong issue that they'll be dealing with. So I wanna engage them in their health care early on. Pediatric colorectal surgery is a very subspecialized portion of pediatric general surgery. There's not a lot of surgeons out there who have additional training specifically for pediatric colorectal. So as a unique part of the Comprehensive Colorectal Center, both Dr. Rentia and I received additional training in pediatric colorectal surgery. I'm a surgeon mom. I will be taking care of your child as if they were my own, because I know what it's like to be sitting there in that waiting room.